Good morning, and thank you for keeping it Citizen Television. We really appreciate your time and company. And it is Wednesday. You know what we do here. Each and every Wednesday, we get into the health and lifestyle segment. And today we want to talk about something that is usually a very big nightmare for parents and caregivers when it comes to taking care of their young ones. Have you ever noticed your child, having difficulties breathing? Sometimes they are snoring in a very uncomfortable way, and sometimes their sleep is interrupted. They cannot be able to have like a smooth sleep because of the breathing difficulties. When they speak, you sort of like feel like their nose has been pinched, like the voice that is coming out is not as clear as what probably their peers. They don't speak the same as their peers, and it is something to do with their breathing system. Have you ever noticed such kind of issues with your young one? Probably it could be what we want to discuss this particular morning, and we'll be looking at how common it is. And the good news about this is that in some cases it's not supposed to be a problem, and when it is a problem, there is a treatment strategy that can actually help your child achieve a high quality of life. I'm talking about adenoids, and with me in studio this morning is an expert on this particular matter and other matters as well. I'm talking about Dr. Cyrus Gakuo Karuga. Karibu sana to the program this morning.
Thank you very much for having me.
All right. So Dr. Karuga is a ENT specialist, that is ear, nose and throat specialist. He's also a head and neck surgeon. So he's here with us this morning to just talk about adenoids, especially its impact on children, how it presents, and probably what they do as experts to be able to help these young ones, achieve quality life, yeah? Karibu sana. So let's begin straight away. Here we usually just try to understand a condition and the body parts, the functions that they play, and when these body parts are affected in what way. So today we are focusing on adenoids.
Yes.
And let's begin by just basically breaking down what they are. And even before we had this conversation, we were already prepping for this, and I already had people asking, what is the difference between adenoids and sinuses,
yes,
tonsils,
yes,
the confusion that is there. So just to make it clear for us, let's begin there.
Okay. So good morning, everyone, and thank you for having me. So talk about adenoids. Adenoids are lymphoid tissues, which means there are some sort of glands which are positioned at the back of the nose. So usually you can't see them directly. Mm-hmm. And they are different from what we call tonsils, mm-hmm, which are the ones which are in the mouth. When you open your mouth, at the back of the mouth, you can be able to see glands on either side of the kilimi or uvula, which are now the tonsils. Mm-hmm. However, they are actually part of a system together. So the adenoids, the tonsils which are in the mouth, mm-hmm, plus some tonsils on the tongue, and others around the nose, which are called tubal tonsils, and they're called the Walde's ring.
All right.
Yes.
There's an interesting picture that even got you excited that
Yes,
is on our background here. Maybe just to explain to us, for somebody to be able to understand their location, because you've tried to explain their difference with tonsils. Yes. If you look at that picture, what are you seeing, and how would you describe it for somebody to understand exactly what you're talking about when it comes to the location of the adenoids?
Yes, so in that picture you can see that the adenoid, the red tissue at the back of the nose, mm-hmm, that is an enlarged adenoid actually. Usually it's a small tissue which does not obstruct the passage for breathing. Mm-hmm, mm-hmm. So it's located at the back of the nose, above the throat or the mouth. Mm-hmm. So it's an area we call the postnasal space. Mm-hmm. So where it is located is also where you breathe through. So the passage from the nostril, and it connects down to the oral cavity and then down to the, mm-hmm, larynx. Mm-hmm. One of the neighbors of the adenoid, and it's important to know this, is the eustachian tube opening, which, mm-hmm, is, I think you can also see it on the picture there. Mm-hmm. Right next to the red enlarged gland, there's a small opening which is known as the eustachian tube opening. Mm-hmm. And that connects the postnasal space to the ear, the middle ear. And, mm-hmm, that is significant, as we'll see, because it causes problems when it's enlarged.
All right, all right. And we'll talk about those problems when it is located there, when it's enlarged, what kind of complications it can cause to your child. Probably you have seen the signs, you just didn't know what it was, or you thought that is how your child was born and that is who they are. probably today you will learn that it's something that you should go to the medical facility to get checked. But then let's talk about before the problem. We are not saying that adenoids are 100% bad,
yes.
you know.
Yes.
They're part of the system, and they have a pivotal role that they play. So yes. Talk to us about what ideally they are doing in the body and preventing the child, you know, from infections and all that. And then now get to the point where we'll talk about when it becomes problematic. What does that look like?
Yes, yes. So adenoids are, as I said, part of the Walde's ring. Okay, that's a group of tissues around the airway and the swallowing passages. So the function initially, especially in childhood, is to collect information from the environment, particles that are coming in through the nose or the mouth, and they collect that data, and the body is able to know what is harmful and what is not harmful, and therefore the body is able to develop an immune system. It is also important for producing antibodies, which can help in fighting infections like viral infections or bacterial infections. So it's like one of the first measures that the body has to help prevent infections. Yes.
So when the child is inhaling, you know, air from the environment, it comes with a lot of particles.
Yes.
So basically what it does is it sort of like sieves.
Yeah, well,
not sieve necessarily, but sort of like knows which one is good, which one is bad, and helps in protection of infections in case there are any particles that are going to cause bacterial infection or viral infection.
Exactly. So it's collecting information and being able to now direct the immune system to know that this is harmful and this is not harmful. So that is part of it, and especially in childhood. So it's important to know that all of us actually have adenoid tissue, but now usually very small, and when they're functional, it doesn't cause any problem.
Yeah. I was about to ask you, because from the knowledge I've gathered so far, adenoids are very problematic when it comes to children as compared to adults, and I wanted you to explain to us why that is so. Why is it that children are more vulnerable to these complications as compared to adults? Does it get better with age, or what happens?
Yeah, so these adenoid tissues are more active in children, because you see, when you're in childhood, the body is gathering more information, so they're more active. They're also more affected by things like allergy or inflammation or infections. And then also the space, the postnasal space in childhood is very small. So again, if they're enlarged, they're more likely to cause obstruction or symptoms in childhood rather than in adults. So that is why you find that this is a problem mostly in childhood. When a child is reaching about 9, 10, and teenage years, then the tissues actually shrink. So it's less likely to cause problems.
Do you have like rare instances where adults have presented with such a complication?
Yes, they do. And sometimes it's surprising. You might find things like TB in the adenoids. That's something that can happen. And it can cause enlargement of the adenoid in an adult and also cause obstruction.
All right.
But it is quite rare.
All right.
Yes.
All right. So at what point does it become a problem? Because we've talked about the function that the adenoid plays in the system of a child.
Yes.
At what point now does it become a problem? The conversation we're having today, just to talk about the complications that are there.
So mostly the problems for adenoids is when they're inflamed. So like recurrent infections with something called adenoiditis, where you have infections, whether viral or bacterial, causing inflammation. But mostly, the biggest problem is when they're enlarged. So when they're enlarged is mostly because of infections, recurrent infections, or persistent allergy. So the tissues become enlarged and they occupy the postnasal space where you're supposed to breathe through. And because of that, then breathing becomes difficult. First of all, we need to know that humans are supposed to breathe through their nose. That is, we're obligate nasal breathers. So when the space at the back of the nose is obstructed, then it becomes difficult to breathe. And especially when you're sleeping and you can't be able to open your mouth consciously to be able to breathe. Now for children, remember also that next to what we call the eustachian tube, and that obstruction of the eustachian tube will also cause ear complications. So when it blocks the eustachian tube, either physically or because of inflammation that is around there, then we have issues that can occur in the ear, like fluid retention in the middle ear or recurrent middle ear infections. And this can actually be something that can lead to other complications. Yes.
All right. You know, when we are just responding to that, there was a question that just crossed my mind. You'd find like in a certain family, the condition of not being able to breathe well is quite common. Some during cold weather, you'd find many people in that family have an issue. Does it have anything to do with adenoids? And is adenoids hereditary? Probably, you know, just so people can get it clear out there.
Yeah, it's common to hear things like, you know, he snores like his dad or he snores like his mom.
Yeah, yeah.
Or mostly the dads. But
is it something that can be inherited?
No, what is inherited is the allergy, because allergy is genetic. So you find that children who have this problem, one of the parents may have allergy. And so they may also have issues with the upper airway, with obstruction, and may also be snoring. But the adenoid itself, for the adult, is mostly not an issue. It may be something else in the nose because of the allergy. There is also a little bit of genetic predisposition to have enlarged adenoids. Yes, but it's not the major issue. I think the more major issue is the allergy. Yeah, and that is why now you may find in a family more than one child also may have problems with adenoids because they have allergies. Yes.
So there's a likelihood.
Yes, there's a likelihood of having more than one child if there's allergy in the family. Yes, correct.
All right. But then what are the common causes of the enlargement of the adenoid? Yeah.
So the most common cause is actually allergy. So
just allergy?
Yes, persistent allergy or non-treated allergy, recurrent infections with a viral or bacterial. Sometimes you may have, rarely, reflux diseases where you have acid reflux going all the way to the upper respiratory tract. And that can cause irritation, inflammation, and enlargement of the adenoid tissue.
All right, all right. There's a question that just came in. We touched on this earlier, but just to emphasize, for emphasis, I think, when we were talking about the difference between adenoids, sinuses, and tonsils, just to recap on what you said.
So we talked about the tonsils being in the oral cavity. We didn't talk about the sinuses. Now, sinuses, yes, sinuses are spaces within the bones that surround the nose. So the cheekbones, the forehead, the bone in the middle, and at the back of the nose. So those bones have air within them. And that air space, the lining is the same as the lining of the nose. It's like an extension of the nose into the bone. Now those spaces are what we call sinuses. So actually all of us have sinuses. They're not as well developed in childhood. So they develop more when you become an adult. But all of us actually have sinuses. So sinuses is not a problem. Problem comes when if
so what makes it problematic?
Yeah, so if you have like infections of the sinuses or retention of fluid within the sinuses, inflammation of the sinuses, in each case we call it sinusitis. Now that is a problem, yeah. But sinuses in itself, we all have sinuses, and that is normal.
So it's like having your eyes. So having eyes is not a problem, but when you have an eye infection, then that becomes the problem.
Yes, exactly.
All right, good to learn that. Let's talk about you know, the symptoms. We've talked about adenoids having a very pivotal role to play in our bodies, but then we've also talked about at what point they become a problem. That's when they are enlarged.
Yes.
So what are the symptoms that would show us that there is a problem here with this child? What do they present? What are some of the complications that a parent or a caregiver can begin to see, to be able to relate whether this could be adenoids and it's a challenge?
So most commonly the child will start snoring. And we need to know that snoring is actually not normal. So when the child is snoring persistently, then there's a problem. And
so snoring is a problem?
Yes, snoring is not normal.
It shouldn't be there.
Well, if you're snoring for one night because you're really fatigued.
Yeah, that's okay.
Yeah, that's okay. But if you're having persistent snoring, then that's a problem. So you have persistent snoring means there's something that is narrowing the passage for breathing. Yes, and in children, the commonest thing that is narrowing that passage in the nasal cavity is the adenoid. So snoring is the first thing probably you'll notice. Another thing you may notice is recurrent ear infections. In which case is because it's obstructing the eustachian tube. But in other children, what you may have is very interesting, persistent bedwetting. Yes, and this is because the child is not sleeping properly, is not having a restful sleep, and therefore they're more likely to bedwet. But in other children, you may have just hyponasal speech, so they're speaking as if, as you said, their nose has been pinched. And that's because the nose is actually obstructed. Some children may present with recurrent sinusitis, and that is because where the adenoids are located, it is easy for them to cause now sinus infections.
All right. You've talked about sleep. I want us to emphasize a bit about that, because that's where usually the biggest headache is. The relationship between adenoids and the sleep challenge, the sleep complication. I know that there's a word for it. It's crossed my mind. You know, what is the relationship? How does it impact a child's sleep? And even what's the overall impact even in the growth of this particular child who is having adenoids and they are interfering with their sleep pattern?
Yeah, so you can have actually a huge spectrum of obstruction in terms of what the child will present with. So first of all, of course, there'll be the snoring, but the child may also have like daytime somnolence or sleepiness because they're not able to sleep well at night. During the day, they're feeling tired, fatigued, sleepy. Okay, so that's one of the things that you'll also see. There's something we call sleep apnea. So
that's what I was looking for.
Yes. So sleep apnea is where you have a child sleeping, they pause in their breathing for a few seconds, and then they start breathing again. So what is actually happening is that because of the severe obstruction, the oxygen levels in the brain actually fall, and because of that, they have a pause in the breathing. But because the body has a mechanism of re-stimulating the breathing, and this is because of rising carbon dioxide in the brain, it triggers the child to start breathing again. So whenever you see a child having those pauses in breathing and then now start breathing again, it means that obstruction is actually quite severe. And that is one of the criteria we use to see whether the child needs intervention. How
common is it? I know you work on a regular basis with people with such complications. How big of a problem is it, the adenoids in children? Like, what are we looking at in terms of the numbers?
It is very, very common. Actually, it's one of the most common worldwide problems in children. And I would say that because, first of all, if you talk about allergy itself, which is the main cause, we're talking about a population of 18 to 25% of the general population. Second is that because of the complications of adenoid enlargement, this leads to surgical intervention. So adenoid surgery is actually the commonest surgery done in children in the world. Yes. So it's a very common problem. And that is a surgical intervention. There are many other children who don't need the surgical intervention, but have adenoid enlargement and are treated medically.
All right. So and we'll get to the treatment options shortly. But before then, in terms of knowledge, awareness, and even the diagnosis, would you say that these numbers capture the real picture on the ground, or we could be having quite a number of children out there who probably have not even been diagnosed for adenoids, and they're part of that demographic that I would call have accepted even snoring. Hii ni issue yetu, hii ni ya familia inakuanga, hii ni kawaida, you know. Like there are people out there who could be having it, but they don't know. Is that a concern for you as experts?
For sure there is. There are a lot of children out there who are not diagnosed. In Kenya, of course, there's also underdiagnosis, and that is because many people may not see it as a problem first. And secondly, they may see it as a problem but don't have proper access to the healthcare they need or the experts they need, because they may be seen by medical personnel who may not be able to direct them to the right people. So yes, it is a common problem, and many people may go undiagnosed and untreated. And unfortunately, this can also lead to long-term complications.
So the numbers here could be higher?
Yes, much higher.
Their parents will be surprised. They already accept, and they are mtoto tu anavalishwa sweater. They say, oh, my child is just sensitive, and they have found a way of working around what they call their sensitive child and all that. But like Dr. is saying, it could actually be something that can lead to long-term complications. So go get it checked. If your child is snoring, if your child is having difficulty breathing, difficulty sleeping, you know, breathing through the mouth as opposed to the nose. They are talking as if their nose has been pinched, something that is not adding up, you know, you just go to a medical expert and rule out any other possibility of a complication. And if the person gives you a green light that your child is okay, then fine, accept them as they are. But it could just be a condition that can be rectified early enough in their childhood. So let's talk about at what point do you need to go to the medical facility, and how do you do the diagnosis for adenoids and confirm that this is actually what we are dealing with?
Yeah, as a parent, I think when you're having a child who is persistently snoring or breathing through the mouth, having hyponasal speech, or having recurrent ear infections, delayed speech, actually, that's one thing that is also one of the presentations because of the ear complications. The child may not be able to hear well and therefore have a delay in development of speech. So that may also be related to adenoid enlargement. So those are some of the things that should tell you to go to see the doctor. Another thing is actually because of persistent mouth breathing, they may have a lot of dental caries or breakage of the teeth, halitosis, which is bad breath or foul smelling breath. The children may also have failure to thrive, which is they're not gaining weight. They seem to be quite sickly all the time, and that could be just because of the adenoid enlargement. So some of those are things should prompt you to go seek medical attention. So when you bring the child, most of the times we just get a good history, because from the history alone we can be able to tell that there's something going on in the nose. So a good history can actually be able to diagnose adenoid enlargement. Examination, we'll be able to see some things like maybe mouth breathing, high arch palate, which means that the child is breathing through the mouth a lot. We may find fluid in the middle ear, which means that, again, the eustachian tube is being obstructed. If you have a specialist center, like where I work, we can be able to do what we call a rigid nasal endoscopy, which you can be able to take a camera and you can be able to see inside the nose and actually see the enlarged adenoid. Another way you can be able to diagnose is by doing an X-ray.
Oh, so you can actually do the endoscopy?
Yes.
So that you get, just explain to me how this helps you, yeah? Yeah.
So you can actually visualize the adenoid themselves directly.
Okay.
As you said, usually you can't see them because they're at the back of the nose.
Yes.
But using a camera, you can be able to introduce a camera just into the nose gently and be able to see.
And this is a child we are talking about,
yes,
yeah?
When children.
Wondering how that works.
We
so
do have a way to
there's like a device that goes through the nostrils, or what happens?
Yes, it's a small camera. It can be either a flexible one or a more fixed one. And just from the front part of the nose, you can be able to see all the way to the back of the nose if you have put some medicine to open it nicely. Okay. Yeah, so that is we call a nasal endoscopy. And that is one of the ways of having a direct visualization of the adenoid tissue. But one of the common ways we actually use, and I think this is available everywhere, is a lateral X-ray of the face. And that enables us to see the tissues around the airway passage, and you can be able to see if it's enlarged and how much space there is for the child to breathe. Yes.
When you say enlarged, is there like a recommended size, and this is what you mean by enlarge, or?
Yes, there is. There's some parameters we use to measure the ratio of the airway passage versus the size of the adenoid. And we can be able to tell how much % of it is obstructed. So if you have more than, remember, okay, there's those physics principles, I think I've forgotten a lot of them. But if you reduce the airway passage, or you reduce a passage by half, it's like the area reduces by ×4, something like that. So when you reduce that passage by half, it causes a major obstruction in the passage.
All right. So after you've done the diagnosis, the good thing about this is that it's not all doom and gloom. There are options, yeah? So what are out there in terms of treatment options? And do all adenoids need surgical procedures to really manage?
No, not all adenoid enlargement requires surgery. We look at the criteria to see whether the child needs surgery or not. But there's medical management for mild to moderate enlargement of the adenoids. And this includes nasal sprays or nasal douching, which means that you're washing the nose with saline, and that helps reduce inflammation, reduce accumulation of inflammatory particles within the adenoid. Anti-allergies, because again, remember this is mostly caused by allergy. Anti-inflammatories, which could include like oral steroids or locally administered steroids. But if a child has things like sleep apnea, which means that this obstruction is actually quite severe, or has persistent nasal obstruction, has ear symptoms, which like recurrent ear infections or persistent middle ear fluid, or has things like dental malocclusion, which means that there's no space for the teeth to grow because of the change in the shape of the mouth. And then these are indications for surgery, because already you're having complications that are more long-term. So in those children, they would need surgical intervention to create a passage for the child to be able to breathe and then to be able to thrive.
So this surgical operation, what does it look like, and what do you do in terms of preparation, and what is done to do? Like, I just need to understand how it's done so that at least you can be able to help the child go back to achieve near normalcy or normalcy if possible. Yes. So when you're talking about surgical procedure, when it comes to dealing with adenoids, what are we looking at?
So I think first of all is to make the correct diagnosis and to know that this is what is the problem. Second is to explain to the parents that this child would do very well if the adenoids are removed, to be able to breathe better, sleep better. Many of the complications will probably go away, like the recurrent ear infections.
So this is like the pre-conversation you have with the parent or the caregiver?
Yes, to discuss how this will benefit the child and why we're doing it. So, I mean, this is something that, of course, we did proper informed consent from the parent. So the surgical procedure itself is done under general anesthesia, meaning that the child has to be put to sleep in theater so that you can be able to remove the adenoids. It's a very safe procedure, and I think anesthesia has really grown in terms of safety. And the procedure itself doesn't take long, maybe 20-30 minutes, but you know, the procedure has a lot of other things involved before you actually do the surgery, which is like the induction of the anesthesia, preparing and making sure the child is ready for it. Then we do the procedure, which is removal of the adenoid through the mouth, although there are many other variations of that procedure, but that is the most common. And then after that, making sure that there's no bleeding, and then the child is woken up. So the total time, maybe if you talk about from entering theater to coming out, averagely maybe an hour or so.
Oh, okay. So it's not like a whole day affair.
No.
But then how is the reception? You know, when you talk to parents and caregivers about surgery and this is a child. I mean, and it's probably for them, wanasema ni homa tu, or it's just breathing difficulty, and then you're now talking about surgery for breathing difficulty. They are wondering, how is that like? Their acceptance and even, you know, understanding why a child at that age would undergo surgeries. Do you get, you know, complications trying to convince parents on that?
Yeah, I mean, surgery is always scary. Whether adult child, and especially now if it's your child, you say this child is so small and going to theater, it is always scary, and that is normal to be afraid of it. However, you know, when you look at the benefits versus the not doing the procedure, you'll find that it is much better to do it than to leave the child, because the complications will be more long-term and persistent. A second thing to say is that now surgery has become very safe. So it's not something that, as much as we're afraid, the risk is very low. And sometimes I say that, I mean, everything in life is also a risk, because like even crossing a road, coming to work, whatever, there's a risk. But this risk has a lot of benefit to you, and the risk is very small. So I think at the end of the day, the benefit of the surgery outweighs the risk that the child undergoes, yes.
All right. I was also looking somewhere, they were saying that not all enlarged adenoids need to be interfered with, that in some cases you just let it be as is. So under what circumstances do you just allow the patient to go? What do you look at to give them the green light to just continue living their normal life without any sort of intervention?
Mostly, especially if you have a short history of obstruction, because those ones are mostly caused by inflammatory processes like a viral infection or or a bacterial infection of the upper respiratory tract. Those ones you treat what is causing it. And also most of the adenoids enlargement, we also need to give medical treatment first to see whether they'll respond well. Unless you
so
have,
that is like the first point of action, yeah?
Exactly.
For every case?
Yes, unless they already have major complications of the adenoid enlargement. In which case, because, for example, persistent adenoid enlargement can actually end up causing heart disease or heart failure. In which case, you wouldn't want to wait for that. So you'd want to intervene to allow the child to recover from that. So yes, so for the child who has maybe an acute infection or acute cause of the enlargement, we can treat, and most of the times they actually recover. But children who have persistent obstruction and have now the complications of the adenoid, then we look at surgical intervention to assist in the medical treatment. Yeah.
You're talking about the common, how this is common, you know, in terms of the diagnosis that you have made, and if you look at the trends, what they're showing you, do you find more cases needing surgery as compared to what I would call the minor interventions?
No, actually...
to show that maybe parents are coming in way late or something like that?
In my case, because I'm a specialist, the patients I get are mostly referred to me because they've been treated medically and
it has
not been able to help, so they're sending to me because I need to intervene. But if you look at the outpatient setting where most parents will first appear, most of those patients are actually treated medically and they recover. Yeah, so most children actually recover from the treatment, and it's only those patients who persist then they're sent to the specialist for intervention. Yeah.
Let's talk about the post-surgical care. So the surgery takes like maximum 1 hour thereabout. So what needs to happen after that? How long does it take for the child to recover? And what is it that parents and caregivers can do during this time, you know, just to help the child, you know, get better?
So for adenoid surgery, first of all, we also have to mention that a lot of the adenoid surgery is done in combination with tonsillectomy.
Okay,
yeah.
okay.
Because the problems causing the adenoid enlargement also cause tonsillar enlargement and also recurrent infections. Now, if you're doing adenotonsillectomy, the recovery is a little bit more, let's say, tougher than adenoid surgery alone. And that is because if you do tonsillectomy, the passage for swallowing is also involved. But for adenoid alone, the recovery is actually quite fast. In fact, most of the times when you do the surgery in the morning, in the afternoon the child is playing.
Okay.
The child is running around, swinging, sliding, playing, running. And so once you give the pain medications frequently, they are able to do their normal activities, and within a week or so, you don't even need to give any painkillers anymore. So the recovery is usually actually quite quick for children, and especially if it's adenoid alone. If it's adenoid and tonsils, then the analgesics or the painkillers have to be more probably adhered to so that the child can be able to eat, because that's the main thing. And after that, they do recover quite well. Yeah.
All right. So you've mentioned long-term complications quite a bit, and I want us to talk about, you know, if this is not addressed as we have explained quite in detail, what are the likely long-term risks that this child is going to face if the parent or the caregiver just let this slide?
Yeah.
Yeah.
Yeah, as I said, there's a large spectrum of complications.
Yeah.
I think one of the most frequent ones are ear complications. So you find, first of all, children may have delayed speech because of fluid in the middle ear or recurrent ear infections. Now, the problem with recurrent ear infections is that sometimes those ear infections can cause a disruption in the eardrum. And in which case now it will cause a long-term ear infection, which is called chronic otitis media. Okay, I didn't want to use that long name, but it means that now there's a hole on the eardrum, and that eardrum is not going to close, and there's going to be recurrent infection even up to adulthood, and associated hearing loss. So now that is for the ear. For the mouth, we have the dental issues. So first of all, you have, because of mouth breathing, you have a lot of dental caries, halitosis, but there's also a change in the shape of the mouth. So if you breathe for long through your mouth, the mouth specializes in breathing, and that is not its job. So what happens is that it the palate becomes high arched, and then the jaws become narrow, and even the face changes in shape.
Structure.
Yeah, because of those changes. Now, because of that change, the teeth are not able to fit. And that is called dental malocclusion. So that's also a long-term complication. And maybe many of the children who end up wearing braces is because of initial mouth breathing. So there's also what we call failure to thrive, and that is basically because chronic upper airway obstruction will lead to changes in metabolism. So the child is not able to utilize the energy they're taking in properly, and so the child is not able to grow. So you find that child stagnates in growth, is not gaining weight, is not able to also learn, and other things are delayed. One of the complications that is most severe, although it is also quite rare, and it happens only when you have persistent upper airway obstruction, is actually heart failure. So what happens is that because of chronic obstruction, the body is not getting enough oxygen, and especially when the child is sleeping. So when they're not getting enough oxygen, the heart has to compensate for that reduced oxygenation by having more forced activity through the lungs.
It works harder.
It works harder. So it can do that for some time. But if it persists for a long time, then now it starts enlarging. And that leads to what you call heart failure. Yeah.
So that's why you were saying it can lead to heart complications as well.
Yes, it can.
Yeah?
Yes, it can.
All right. You mentioned something about a child who's breathing through the mouth, developing is it bad breath, or a breath that is not very pleasant through the mouth?
Yes.
How is that coming about?
So there'll be two main things. One is because of breathing through the mouth, there's drying of the mouth.
Yeah.
And you know, saliva is important for lubricating the mouth and clearing the bacteria. But if you're breathing through the mouth for a long time, then it becomes dry, and then the bacteria are able to thrive. And that is also the reason why they get also the dental caries. But it also causes bad breath. Another thing is the inflammation of the adenoids will lead to mucus dripping at the back of the nose. And that mucus will also, most of the times, carrying some bacteria, because bacteria love mucus, and that can also cause the foul-smelling breath.
All right, so this actually just points to the fact that the earlier the better, you know, for any parent, for any caregivers, the earlier the better. As soon as you see some of these telltale signs of, you know, your child having an issue, you better just take the child to a medical expert to be able to get checked. I want to talk about the issue of cost. I don't know whether it is as simple as you made the procedure seem.
Well, it depends a lot. Of course, this is also done in government hospitals as well, and also in private hospitals. In terms of cost, it varies depending on
where you're going.
Yes, it depends on the facility you're going to, how they cost the procedure, because some hospitals may have packages, others may have cost based on what is consumed, and so it can vary. For public spaces where I have worked for a long time as well, we used to do a lot of adenoid surgery, and of course at that time we'd be able to use social health insurances and such things. So yes, it is accessible in that way. Yes.
All right. There's a question here with regards to the surgery that you've just talked about, and even I think it touches on the interventions. Somebody wants to know whether it can recur, like after that, does it recur, or it's done like that?
Yes, that's an important question, and very common question as well. There is a chance of recurrence, and mostly in children who have very aggressive allergies. And those children will actually most of the time present at an earlier age. So you'll find a 1-year-old with a very severe obstruction. And you see the intervention may still be necessary even at that age. However, because first of all, it's been done very early, and second, because the allergy is very aggressive, the chances of recurrence are higher for such children. However, usually at the age of, as I said, 8 going forward, there are changes that happen also in the child. One of the things is that the adenoid tissues are not as active, so the enlargement is not as pronounced. Second thing is that the face actually grows, so the space at the back of the nose is also bigger. So again, the obstruction is less likely to happen. So I would say recurrence is more common if the surgery is done early and in younger children, and if the allergy is more aggressive. So you may have higher chances of recurrence. But even when you talk about that recurrence, it's only about 5% of those children. Yeah.
It can recur, you know, but the chances are not that high, so there's a possibility. There's one person who's also talking about the child having noisy breathing. Please tell Daktari to talk about noisy breathing and whether this could be a sign of adenoids and generally the other causes of breathing complications, I think aside from adenoids.
Yeah, so noisy breathing, especially in children, as we had mentioned, is most likely to be caused by adenoids, because adenoids are the commonest cause of upper airway obstruction in children. But there are other things, and one of the things, of course, is the tonsils also, because the tonsils are also along the airway, and they can also cause obstruction. But not necessarily only those two. In the nose, we can have what we call turbinates, which are swellings on the outer part of the...
You started again with your jargon.
Yeah, on the outer wall of the nose inside, there's some swellings, and their job is basically to warm the air, moisten it as you breathe, and they're known as turbinates. And in some children, that can also be enlarged, and especially if they have allergies. Something else that is important to note is that sometimes you may have growths, tumors, whether benign or not, within the passage of the breathing. So it's also important to make sure that it's not a tumor or growth that may even be more dangerous than adenoid enlargement. Yeah.
All right. There's this common problem about, you know, especially when it comes to children, you'll find that they usually get a lot of infection, homas and coughing, and it's very frequent, and parents have turned into doctors because of that. I don't know, probably as an expert on that particular area, probably could tell us what are some of the things around us that makes children vulnerable, and what can parents and caregivers do, and also a word of caution when it comes to self-medicating your child as well.
Yeah, it's very common for children to get upper respiratory tract infections, and the main reason is that they have no immunity to it. So in our world, we live with thousands and actually millions of viruses. And many of these viruses can cause upper respiratory tract infections. And these children are not immune to them. They have no immunity. So especially when children start going to school, and then they start encountering...
You treat them today, after 2 days they are back at it.
Yeah, that is very common. And because they're encountering children who have come with different viruses from different backgrounds. So it's still part of their development and their immune development to get these infections. Now, the main thing is to help the child not have severe infections when they get them, because it's almost inevitable, especially viral ones. So the main thing is to build the immunity, like ensuring that they have a nice balanced diet, avoiding sugars, keeping them warm. So those are things that at least will help. Even if they do get the viral infection, it's not so severe. Yes.
All right. What about...
self-medication.
Exactly, because we have a chemist somewhere there in the house where you just ask the child how they are feeling, and you know the drug to administer. Could be a good thing, but experts say that can also be counterproductive. So what are your thoughts on that for parents and caregivers?
I think we should avoid as much as possible to self-medicate. Even for doctors, you should not self-medicate, because you may think you know what is the problem, but it may not be the actual problem. However, that said, most of these infections are actually mild infections, mild viral infections. And it is okay to observe a day or two. You can give basic medications like paracetamol to ensure that at least you control the fevers. But if it persists, then I think it's important you seek medical advice. But one thing I would like to encourage people to avoid is antibiotic use, which is self-prescribed, because When you do self-prescribed antibiotic use, you are risking causing what you call resistance, drug resistance. Because you may not be treating the right thing, and the bacteria learn the antibiotic that you use, and now in the future, you may not be able to treat the same infection.
All right. As we go back to, we're just about to wind up. I want us to go back to what you were talking about, adenoids, a word of caution. I know we've talked a lot about what it is, how it, what are some of the main causes and even some of the symptoms. But what are your biggest concerns? Given a chance to just talk to parents and caregivers who are watching us this morning, what is it that you'd like to really emphasize for them to remember about how best to manage this particular condition?
Yeah, I think the main thing I would like is to say that snoring first is not normal. If you have persistent snoring, then there might be an issue along the airway, because that is an indicator of a narrowed part of the airway. And of course, in children, mostly caused by adenoids. So if the child is snoring persistently...
But we have people who've snored like ever since they can remember, and they felt like this is normal, this is part of who we are. They've been accepted in the family like that.
I agree, and many people can actually live with it. But again, you know, there might be some silent issues happening with the snoring. For example, if you're snoring for long, as an adult especially, you may actually develop hypertension because there's a whole chain of connection between reduced oxygen levels in the brain and increased blood pressure. So it can actually lead to things like hypertension and its complications. So snoring still is not normal. If it's okay 1 day or two, which is explainable, that's okay. But if it's a persistent thing, then there's something obstructing.
It shouldn't be a lifestyle.
It should not be a lifestyle.
Okay.
So yeah, so that's one thing that maybe I'd like to tell parents, that snoring is not normal. Then if you see your child, for example, 2 years is not saying a word, maybe there's something causing hearing loss. And it would be important to have the child assessed to see why is the child not speaking. Is there something causing delayed speech? Is it because they're not hearing well? And again, you find a lot of times there could be middle ear effusion caused by adenoid enlargement. So that's one of the things also. Or child is not thriving. This child is always unwell, doesn't seem to be gaining weight and such things. Then, yeah, you may need to see a medical specialist to see what's going on.
And the lack of thriving could be actually even due to lack of sleep.
Yes, yes.
We know what sleep does to the growth of a child, and even lack of eating, you know, feeding well, because they are breathing through the mouth. So you can imagine how, you know, stressful it could be for them to really like feed well. So that could also be caused through that complication. Thank you so much, Daktari, for creating time for us and for explaining to us what many thought probably was not an issue, but seems like it's a very big issue that needs to be checked. We were talking about adenoids, and of course he has run us through, these are very common signs. You have actually seen them on your child or somebody you know, a neighbor, a friend. When you see a young one snoring, having mouth breathing, persistent congestion, nasal drainage, ear problems, of course noisy breathing like we added later, bad breath, sleep difficulties, and having fluid in the ear, hearing loss, speech development complications, and I can go on and on about the complexities of what adenoids can cause in the life of a child. But then, Daktari, after having had all that, you know, where can we find you probably? Yeah,
so I'm based at what we call Prodigy ENT and Hearing Clinic in Upper Hill at KMA Center on the 3rd floor.
All right.
Yes.
All right, all right. In case we didn't respond to any question that you had, probably you can be able to get that answered. Thank you so much for creating time for us, and I'd just like to wind it up there. Of course, remember there's still a lot that we are working on for you. Today we'll also be following up the ongoing interviews of the Independent Electoral and Boundaries Commission commissioners going on right here in Kenya's capital, Nairobi. But for health and lifestyle, that's the much time we have. Asante sana for watching, and keep watching Citizen Television.